Hello everyone, welcome back to Fine Nursing Tutorial YouTube channel. In this class, we'll discuss very important and interesting topic, lumbar puncture. Who all have visited first time on this channel, please do subscribe and watch. Here, we'll see what is lumbar puncture. We'll see the meaning, definition of lumbar puncture. Lumbar puncture, also known as spinal tap. It is a medical procedure involving the insertion of a needle into the lumbar region of the spine to collect cerebrospinal fluid for diagnostic or therapeutic purpose. Here, lumbar region, that is lower region, lower CSF for diagnostic, or it may be for the therapeutic purpose. Next, we'll see the indications of lumbar puncture. First one is a diagnostic purpose. Here, we'll see diagnostic purpose. Here, evaluation of central nervous system infections. Diagnostic purpose in the sense to evaluate the CNS infection, meningitis like encephalitis, and then diagnosis of neurologic disorders, that is like multiple sclerosis, Guillain-Barré syndrome, and then also to detect blood in the CSF, subarachnoid hemorrhage, and then also to measurement of CSF pressure, to also measure CSF pressure. This is all about the diagnostic purpose. Next comes to the therapeutic purpose here. Removal of excess CSF to relieve increased intracranial pressure. For that one also, there will be the indication of lumbar puncture, and then administration of medication directly to the CSF. Next, we'll see the use materials in lumbar puncture. What are all the materials they are going to use for the lumbar puncture? First one, sterile gloves and drips to maintain aseptic condition, and then local anesthetic, that is typically lidocaine for numbing the skin and deeper tissues. Local anesthetic can be used. And then spinal needle, a long thin needle designed for assessing the spinal canal. And then fourth one is manometer or pressure transducer to measure CSF pressure if needed. And then fifth one is collection tubes, that is sterile tubes for CSF sample collection. And then dressing materials, that is bandages or sterile dressing for the puncture site. These are the materials used in the lumbar puncture. Next, technique of lumbar puncture. In this patient positioning, patient usually positioned in a fetal position or seated, leaning forward to widen the spaces between the vertebra. And the skin preparation, clean the skin at the puncture site using antiseptic solution. And then local anesthesia, inject local anesthetic to numb the skin and deeper tissues. And then needle insertion, here insert the spinal needle between the lumbar vertebra into the spinal canal until CSF is obtained. That is needle insertion. And then CSF collection, collect CSF in sterile tubes for analysis. These are the techniques they are going to use while lumbar puncturing. And also here, pressure measurement, that is measure CSF pressure if indicated using a manometer or pressure transducer. And then needle removal, remove the needle and apply a sterile dressing to the puncture site. And then post procedure monitoring, so important here, monitor the patient for any complications such as post lumbar puncture headache. Next, we'll see the complications of lumbar puncture. Here, post lumbar puncture headache due to CSF leakage and then usually self-limiting. And then infection, risk of introducing bacteria into the CNS. And then bleeding, rare but can occur, especially in patients with bleeding disorders we can see. And then nerve damage, rare, it is rare, but injury to nerves may occur during the procedure. And then herniation, in patients with elevated intracranial pressure, increased intracranial pressure, lumbar puncture can lead to brain herniation. These are the complications of lumbar puncture. I hope you all are very clear with the lumbar puncture. Please like, share and subscribe to our YouTube channel for more information. Thank you for watching.